15 years now, so I've had quite a good feeling of the complexities and the difficulties that village hall committees have to face. And obviously with the latest pandemic, it's been particularly difficult to manage all of the legislation and the restrictions that you've had to sort of get your heads around. So I hope this session, it's not just about the pandemic, it's a little bit about cleaning in general. And then it goes on to how that fits in with the COVID and the restrictions that you've got at the moment. I'd like to say a little bit about my past or history work-wise. My very first career after I left college, I did hotel and catering at college, and then I went to work in the NHS, working as a domestic services manager. So for 8 or 9 years, I was in the role of managing cleaning of hospitals. So in a way, the session on cleaning fits in quite well with the principles of cleaning for village halls, especially with the COVID at the moment. I'm going to try and share my screen. So hopefully, like Emma said, the technical bit will work. So can you see, you see the slide? Okay. I'm sorry, I've got the slideshow down the side. You haven't got a full screen there, but that's fine. That doesn't really matter. Okay. So to move on, do they just slide down?
You might be better turning your video off, Helena.
Okay.
Your voice is getting a bit chopped since you put the slides on. So.
Okay. I've turned my.
That's
okay.
better.
Is that better?
Yes, it is.
Thank you, Jonathan. Thank you for that. Okay. So we will have to sort of get on quite quickly because there's quite a lot to cover. And I'm very conscious that 2 hours isn't really long enough to cover the whole subject and all the issues. So it's really just touching on the basics rather than all the in-depth information. We're not going to cover everything and maybe not be able to answer every single question that you have, but we can get back to you at a later date if you've got queries that we can't answer today. So that's a basic overview. About just before 11 o'clock, we'll have a coffee break. We'll go on to talk about COVID after the coffee break. Before coffee break, it's more about the basics of cleaning and hygiene and disinfecting in general. So the overarching legislation that all of the health and safety that we are dealing with during the COVID pandemic, the main legislation, it all falls back to health and safety at work. So everything that comes under the Coronavirus Act and all of the legislation about health and safety and what you should and shouldn't be doing, it actually falls within health and safety at work, which we all are aware about. We know about health and safety at work. The people that are really regulating the environmental and the health and the hygiene side, as you probably know, is the your local environmental health officers. So if you've got any issues, any queries, anything that you need to have specific information, if we can't answer that query, we'd always recommend that you speak to your local environmental health department because they're only too pleased and too happy to help where they can. So, as I said, we're going to talk about basics of hygiene and why we need to clean. Obviously, we want a place to look nice, clean and hygienic and welcoming for people to come into. So surfaces must be cleaned, as we know, with water and soap or detergent. And that is because we've got to remove the grease and the dirt. And you do that before there's any disinfection that takes place. If you don't remove the dirt, the dust, before you put the disinfection on, the disinfectant is not really going to work. So the cleaning is the essential part in the process, and the disinfection is actually the secondary part in the process. So the detergent or the soap is essential. And the reason being that the dirt or the dust will not leave a surface without the detergent. It will not be lifted from the surface because the detergent is needed to break down the surface tension between the grease and the water. And it's called a surfactant. And perhaps you've already come across that term before. That is essential, as I've said, to lift the dirt, and it suspends the dirt in the water. Without the detergent, you can wipe with a wet cloth and the dirt or the dust will still remain on that surface. It's not being lifted. So basic hygiene is down to really removing the dirt and the dust rather than the disinfection. So that's the first part that your cleaning basics need to understand. And when your cleaner is cleaning, they need to be taught to clean from the least soiled area. So they clean from the cleanest area to the most soiled, dirtiest area. Otherwise, you are spreading some of the debris and particles into clean areas. So always clean from the cleanest first. Okay. So why do we want to remove the dust and the dirt? If there is no dust, dirt left, whether that's soil, crumbs, whatever kind of debris there is, if there's none of that around, then the bacteria cannot survive. So this is the really basics. This is going right to the basics of cleaning. Why do we need to clean? We want to clean to make sure there's no bacteria on those surfaces. Bacteria will only be there, only survive if there is food, water and air. It's like any other living organism. They will not survive if they haven't got all three of those basic life, issues. So the food is basically the dirt. So if you remove the dirt, then any bacteria around cannot survive. There's always water and moisture because there's moisture in the air. We've got damp atmospheres. Washrooms, kitchens are specifically prone because they're damper areas. So there's going to be water and there's going to be air around. So the thing that you can control is to remove the dust and the dirt. And then bacteria cannot grow and they cannot multiply. So that's really the basics of cleaning. If you've got dirty surfaces, you've got the potential of bacteria, then we're talking about viruses, which are different to bacteria. It's a different sort of, they're not actually living organisms themselves. They can only survive and multiply if they have got a living host, a living organism, a host cell. So that host cell can be people, animals, but also viruses can live or can infect bacteria because that's a living organism. So if there is bacteria around, there is a potential for the virus to get into the bacteria and take over that cell. So it's going back to the fact, if there's bacteria there, you've got a higher risk of the virus being on the surface. So it's quite crucial that if the area is clean, less likely to have bacteria, and that in turn is less likely to have virus being on that surface. Of course, the virus can survive without a host cell, and we'll talk about that a little bit later. Each one, each different type of surface, the virus can survive for different lengths of time, and we will talk about that after the coffee break. But in principle, if there's no bacteria and it's the virus has exceeded its lifespan, whether it's hours or up to 5 days, it cannot survive because they've got nothing to feed on. They can't go into a host cell. So cleaning is the vital part, always. Right. So it's up to the village hall management committee or the parish council or whoever manages the premises. It's their responsibility to make sure that the cleaners or the caretaker or volunteers, you may have volunteers that clean the hall, but whoever they are that is responsible for the cleaning, it cannot be left just up to them. It's up to the village hall management committee as their employer or as the responsible body to make sure that their staff or volunteers are trained properly, and that you provide them with the safety equipment and the proper cleaning products. You cannot rely on somebody that's perhaps just gone into the village hall and done the cleaning for many, many years and just let them get on with it. Because if that's the case, you've actually no control over how that cleaning takes place. Is it being done correctly? Have they got the right products? Are they using the right products, disinfectants that will kill viruses? You cannot just rely on people to know or carry on as normal. It is down to the employer, the village hall management committee, to do this in a strategic way, as though you are employing somebody in any other walk of life. You are responsible for those people. Because again, you've got to think whether your insurance would cover the village hall trustees if anything did go wrong. So one of the ways is to make sure that you are instructing your cleaner or caretaker so that they know exactly what needs to be done. You can't assume that they know what to do. You've got to instruct them. So this has to be a formal, written down process. So you have to work out what the cleaning schedule is going to be. Halls are all different. So some halls are used regularly, several times a day, other halls several times a week. Some halls may have several rooms where you've got different groups using the hall at the same time. So it's quite complex how you are going to manage and what needs to be cleaned, when it needs to be cleaned, and who's going to do it. So as managers, as the people responsible, you need to strategically list down everything that needs to be done, when it needs to be done, and who is going to do it. So a good way to start that is to look at the high priority cleaning areas. Work surfaces, chopping boards, kitchen equipment, fridges, sinks, soap dispensers, reusable cloths, whatever you need. You've got to look at the high priority. Look at the frequently touched items. So then that would give you an idea how often you've got to clean. If they're used a lot more than other items, you have got to clean those on a more regular basis. So it's quite common sense, but unless it's done strategically and looked at and written down, how does your cleaner or caretaker know precisely what needs to be done? So it's a common sense approach, as you would with any other type of employer. Yes, and then look at the places that might not be so high priority. So write down what needs to be done, how often the item is cleaned, what cleaning products to use, what equipment to use, when and how often the item is cleaned, or what days it's going to be cleaned. If, for example, it's cleaning windows, it might be once a month, it's a day. Obviously, these are things that have to be written down. And for each activity, are there any specific protective and safety measures that need to be accounted for? Again, you can't assume that your cleaner is going to know that there might be a slight danger. So it has to be written down in a formal way. You may have contract cleaners as well. I mean, I don't know of a village hall that uses contract cleaners, but it could be that you have outsourced that job to a contractual cleaning company. Again, don't just assume that they're just going to come in and know what to do. You need to set down like a service level agreement or a contract and say, this is what we need you to do, so that you know that that contractor is fulfilling what is required by the village hall trustees. Okay. I think this is good practice. Universal colour coding system set out by the British Institute of Cleaning Sciences, no less. Most halls will probably just use 3 colour systems. This is covering clinical areas and hospitals. So it may not be necessary to have 4 colours, but the idea is that any cleaning materials, cloths and mops that you are using, you're not increasing the risk of spreading transmission, cross-contamination between different areas. So if you are cleaning the toilet room, washrooms, sanitary fittings, you would need a mop and cloths that are marked red, so that you would not be using the same equipment if you were then going into kitchen areas or a bar area, as in the green. And I'm assuming that most village halls would have some sort of a system that you're not using equipment in different high-risk areas. Yellow at the bottom, I know is used in hospitals anyway. They are using a different colour cloth here to wash basins and washroom surfaces, whereas they'd use the red if they were cleaning the toilets. So that is quite a distinction there, but that is in more higher clinical settings. So I think it would be acceptable for village halls if you are using just the 3, the blue, the green and the red, and just instruct the cleaners not to use equipment, mops and cloths in areas that they shouldn't be doing that. And that's explaining the same thing again. Just written out the different areas where those different colours would be used. Right. So this is the storage of chemicals and cleaning agents. All of this information, and there is further information in the ACIT Village Hall Information Sheet 20, which is health and hygiene in village halls. So if you need further information, it is a good one to get hold of. And its good practice guidelines should be followed to avoid these hazards. With any chemicals and cleaning agents, you've got to take care. So you would be instructing your cleaner to always read, understand and adhere to the labels and instructions. It's probably good practice that the trustees do that to make sure that they know that they're telling their cleaners or provide the cleaner with the right equipment, the right chemicals to use. You are responsible providing the right safety protective wear. So that's usually rubber gloves, an apron or an overall. Unlikely that they would need goggles, but if they were doing something that was using high chemicals within the hall, then you would have to perhaps provide them with safety goggles. Do not mix chemicals. For example, if bleach and ammonia were accidentally mixed together, they can cause respiratory irritation and potentially fatal gases. And that's particularly dangerous if you are working in a confined space like in toilets. So if somebody accidentally was putting the bleach toilet and then came back, somebody else put some sort of, eventually it can be fatal, which is very extreme. But there is that danger, and it just highlights that if people don't know what they're doing with these chemicals, they can be very, very dangerous. So common sense, never put chemicals into unmarked containers or into bottles which are used for any other purpose. Store chemicals away safely, keep lids on in a locked cupboard or a storeroom. So this is down to the trustees to make sure that these practices are put into place and that there is the capacity to store the cleaning products correctly. Keep away from children, pets and others during application. So, okay. So we'll go on to talk about disinfecting in general. If you've been following the AIC information sheet on reopening, this is explained. It's also on the gov.uk website for the safe reopening of village halls. There's lots of information online about the types of disinfectant solutions to use. So there is a choice. As long as you use one of those three, you will be safe when you're disinfecting surfaces. So it could be a combined detergent disinfection solution, as long as it's got that 1,000 parts per million available chlorine. Again, when you're purchasing and choosing the solutions that you buy, read the labels to make sure that it is that high standard. The second way is to do it in two processes, like I said earlier, to clean first. So you'd have to clean the surface first with a detergent, follow that by using the disinfection, again at that same level. Follow the manufacturer's instructions for dilution, application and contact times for all detergents and disinfectants. Some disinfections I think it varies between 30 seconds and 5 minutes for them to be effective. So again, just make sure you know that you're using the product that fits in the way that your cleaning is being carried out. If an alternative disinfectant is used, ensure that it is effective against viruses. I've checked my household cleaning and I've got two products, and I hadn't actually looked at them properly, and I shouldn't be mentioning commercial names, but the Dettol spray actually says on this that it kills bacteria and viruses, and it also says it does kill the human coronavirus. I have another product which is it's a supermarket's own brand, which I thought was exactly the same, but when I actually read the label, it says it only kills bacteria. So that was a good exercise for me, and a lesson learnt for me, that unless you read the labels, you don't really know. You cannot assume that it is doing the job that you need to do. Okay. So when you're disinfecting a surface, it's to actually not necessarily get rid of everything, but you are reducing the potential infectious dose of the virus below a level that would cause disease. So it's making it as safe as possible. It's not saying it's eliminating everything. You're just trying to reduce the level it would cause disease. 9.9% kill rate, and that's exactly what the Dettol is saying on that bottle. 99.9%. What they're saying here is alcohol-based hand sanitizer is not ideal for disinfecting hard surfaces because the alcohol content is not high enough. So don't think that hand sanitizer can just be put onto a cloth and then used to wipe hard surfaces. They do two different jobs. And when the cleaner is doing the cleaning, try and avoid splashes and spray when cleaning. Because in actual fact, that would spread. If there was any virus, you're actually spreading it rather than just trying to kill it and remove it. If you are diluting and making your own disinfectant, store it in opaque containers. It has to be in well ventilated, covered areas, not directly exposed to sunlight. And if you're making it, ideally, it should be done freshly every day. So I don't know how many people do mix their own disinfectant solutions up, but perhaps in larger catering establishments, they may do that and just use it as a regular process. I'm not sure if people in village halls are mixing their own disinfectant, but it is important that if you were doing that, to store that in the right way. Also check if you, when you're cleaning kitchen areas, check that the product that you're using is actually safe to be used in kitchens and safe to be used around food areas. Looking at disinfectants to surfaces via spraying, I've read it's not recommended for COVID-19 to use that. If disinfectants are to be applied, these should be done via a cloth or a wipe, which is soaked in the disinfectant. So in indoor areas, it's better to use it on a cloth rather than to spray it. And again, leave on the surface for the recommended time. I think we've seen loads of posters around. These are the NHS posters that are available from Public Health England. It's good to have these up in your village hall premises in various places. You've got to remind people that hand hygiene, face coverings and social distancing have to be maintained all the time. Hand hygiene is actually the biggest battle against the transmission and cross-contamination. You know, any virus that's on any surface within the hall, if it is touched, then the more people are washing their hands during a session, the less likely that they're going to, you know, cross-contamination from different surfaces to different surfaces. So if anybody does want to get hold of these posters, I've got, I can send those electronically, and then you'd have to print them off. So we've got a short video clip that Emma is going to show now. And this is about how the virus can be transmitted in the air. We can't see how the virus is being transmitted. So this is a very short clip to show how it can be transmitted. Let me just get rid of it. J. Jonathan Bird. Hyphen. Kathy Bowers. Mike. Hi, Emma.
Yes.
Ah, yeah. There was no sound on that.
Oh, you're kidding. Okay, shall we run it again? And I'll.
You need to make sure that you have set Zoom to allow it to use not just your microphone, but the background standard sound system.
We tested it yesterday and it worked with sound. So
Okay.
it's typical that it feels that.
But we can follow the link and listen to the sound separately if that's easier.
Let's just. Well, I don't suppose this is going to make any difference. You didn't
hear that? You hear something? Yeah.
I did. Okay. Maybe it's just because my microphone was muted.
Every action counts when it comes to protecting ourselves and our loved ones.
Okay. We've got the sound, but not the picture.
Yeah. So I'll share the screen again now. So
thanks, Emma. Thanks, Emma.
Every action counts when it comes to protecting ourselves and our loved ones from the coronavirus. Washing hands, wearing a face covering, and making space are vital in helping to stop the spread of coronavirus. Letting fresh air into enclosed spaces regularly throughout the day will also reduce the spread of the virus, particularly important in the winter when we spend more time indoors. Coronavirus is spread through the air via large droplets and smaller particles that come out of the nose and mouth of an infected person as they breathe. Coronavirus droplets are heavier and so fall out of the air quickly. But lighter coronavirus particles float in the air. They can linger in a room or any enclosed space, and other people can breathe them in, becoming infected. By opening windows regularly throughout the day, you can remove the infected particles that are lingering in the air so people can't breathe them in. This is particularly important if you have visitors in your home. Make sure you open a window before, during, and for a while after their visit. Keep the visit as short as possible too, and make space. It's easy to let fresh air in without losing too much heat. You can leave a window open a small amount continuously throughout the day, or open it for short, sharp bursts, 10 to 15 minutes every couple of hours. Also, using extractor fans in bathrooms and kitchens more frequently will remove particles more quickly. If every single one of us keeps doing our bit, we really can keep coronavirus at bay. And remember, hands, face, space.
Thanks, Emma. Right. Right. Can you see the screen okay again now?
No.
Oh, yeah.
You got the pictures? I've got to share screen again. Hang on, wait a minute. I'll get minimize. Sorry. Trying to minimize this. Oops, I've lost my screen now. Right. I don't seem to have a picture of the slides on the screen. Can you see the share? Can you see the slides?
No.
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 You're
Okay.
not sharing currently.
Right, okay, let's go there. You
That's
see, I'm
better.
not used to doing this, Jonathan, so
worry.
bear with me.
There you go.
Okay,
We're seeing them
that's
now.
You've got it on again. Okay,
Yeah.
so that's quite a good, I think, a visual illustration of how the virus is in the air, the aerosol transmission. I think it's quite scary in a way seeing that, and the virus particles are lighter than other bits. So the virus is dropping to the floor, but I think it said viral particles are lighter and seem to be the ones that are spreading in the air. So again, and it's in the special hiring conditions for your hirers that it's their responsibility when they sign the hiring agreement that they really follow those instructions that are on there. And it is written in there that they have to make sure that they keep windows and doors open during the session, not all the way through if it's a cold day. There is that fine balance of, letting all the heat out the room, but they could intermittently open the windows, let the air flow, fresh air come in and close them again, and then open it again, say 20 minutes later. So they have to make sure that they're doing that because it's keeping their users, their group safe, and that's their responsibility. It's the hirer's responsibility to follow the instructions that the village hall have given to the hirer. So the actual safety of their attendees is down to the hirer, because you as trustees have fulfilled your legal responsibility by instructing them to do that. So that's quite important to stress to them when they're hiring the hall to follow those special hiring agreement conditions. Right, we've got through that quicker, so then I anticipated. Has anybody got questions at this stage? No chat questions coming through. I think it says coffee break 10 minutes. I'm going to skip over that. We'll just go into a little bit more about, we can start the spread of COVID-19, because that fits in quite well, seeing that aerosol transmission of the virus in the air. So the first point here, person to person through small droplets, aerosols. We've just seen that on that illustration. The second and probably the most common one is direct person to person contact, which is handshakes. That's why the hand sanitation is so important. And then if any surface in the village hall has been infected and then people come along, touch that infected surface or any equipment or any activities that people are doing, contamination, it can be contaminated when an infected person coughs, sneezes or touches that surface. I think we all know that they're the three common ways of transmission, so that's why face masks by users in the hall now is mandatory unless they've got the special exception not to wear face masks. But it is important for those aerosol transmission to try and reduce the aerosol transmission. Hand sanitisation when they arrive, during, if possible, during the event, if they are touching lots of different surfaces. If they're doing an activity where they're not really doing anything apart from perhaps sitting on a chair listening to a speaker, and they're not going around touching lots of surfaces, they wouldn't need to hand sanitize during the session. If they were doing things where they were moving around and touching things, then hand sanitation would be advisable during the session. Also, and when leaving the hall, they'd need to do the hand sanitation. This got me thinking myself that I'm a little bit guilty here. When I go shopping, and we all queue up to the supermarkets and we all got hand sanitation when we go into the supermarket, it got me thinking that actually when I leave the supermarket, I am not hand sanitizing, but actually if I've touched a service or anything, a product inside the supermarket, there's a good chance that I could have that virus on my hands. So to protect myself when leaving, we should hand sanitize. But I don't know if I'm the only one here, but I know next time I go shopping, I'll make sure I do hand sanitize when I leave, as well as when I go in to a shop. We don't really know what we're touching, do we? So obviously the frequently touched areas in the hall: door handles, toilet flush, light switches, telephone, furniture, taps, kettle handle, equipment, pens, anything that's been used within the hall. Those are the things, the frequently touched things have to be wiped down regularly. If there are people close to each other, especially in poorly ventilated indoor spaces, again, and when people spend a lot of time together in the same room,
Helena,
it increases the risk.
Helena,
yeah.
we have a question from Trish, just asking about a hairdresser situation. So if there was a hairdresser using a village hall for their business, would that create a hairdryer? Sorry, if a hairdryer was being used, would that make things worse, do you think, blowing the virus around?
Yes.
It will send it around. If the hairdresser is in the village hall, I'm assuming that they've only got one client at a time. To use it as a multi-purpose, with several clients and several hairdressers using the hall, might be more tricky, and they'd have to follow the guidelines for their industry. And I don't know what that would be. I'm assuming if they're using it for work purposes, that there'd be one hairdresser in there with one client at a time. So if it's spreading, if a hairdryer is used and it's spreading it in an aerosol around the room, it's the person that's sitting as the client isn't going to be put at risk, because they may, if they've got the virus, it's their aerosol that's been spread. So it's in the hairdresser, if they've got face coverings or visor on, they're protected in that way. I'm not sure on the regulations for hairdressers, but potentially yes, it would be spreading it further. But I would be very concerned if a hairdresser was using it for more than one client at a time.
Yeah, so, Tricia said it's just one client with the hairdresser with the doors open.
I think if I was a trustee and a hairdresser wanted to use the hall, I would, make sure they know the special hiring agreement terms and that they are following the industry regulations for their particular industry. I don't think you could do much more to minimise the risk. I think it would be okay to do that, to let the hairdresser using it, because it's only on a temporary basis, I'm assuming. Do they normally use their village hall for hairdressing? Or I'm assuming they're using it on a temporary basis. They may be doing that in the hall rather than going into people's homes. So it depends on the individual circumstances. And things like talking loudly, if you've got a guest speaker, they're better with a microphone rather than having to speak loudly in front of a room of people. That's spreading the, further, the aerosols are being projected further into the room if they're talking loudly. The same with singing. When somebody coughs or sneezes, it can go, many yards and then circulated around the room. So ventilation is key. It's one of the things that they say in any indoor space, ventilation is an important thing. So what's the next slide? I think it depends if you've got air conditioning. I don't know a great deal about air conditioning, but I think if you do have an air conditioning system in the hall, you'd need to check that it is serviced and it's working properly. And if you're not sure, maybe to talk to the engineer or the company that fitted the ventilation system to make sure that it is working properly and is it doing the job that you need for the coronavirus. And I don't know if you can set them for how many people are in the room. I'm not sure about you know, these ventilation systems, how they work, but if you've got one, it's just worth bearing in mind to check that it is adequate and doing the appropriate job. So yeah, talk to your heating ventilation engineer, HVAC, which is heating, ventilation and air conditioning engineer. Right, so I think we could have a coffee break now. We've got through quicker than I expected this morning, and then we can go on to talk about how to reduce the spread of the virus and what would need to be done for cleaning if you've got a suspected case or a confirmed case of the coronavirus. If there's no more questions now, are we happy to have a break and come back at 11 o'clock? It's 10 to 11 now. I think that's a good place to stop. We'll have a coffee break.
Yep. So we'll.
If you've got any queries in that break and you want to put them into the chat, then Emma can collate those together. So that will be a good opportunity to pose any questions. Okay, I will stop sharing for now. No, I'll put it there. The coffee break, I'll leave that like that. Okay.
Great. Okay, see you all in 10 minutes.
Right, I don't know if you've had a chance to have your cups of coffees or sit with your cups of coffee, that's fine. So I don't think we've had any queries come through on chat, not that I'm aware of. So if you do have any questions, please do forward them on, because it is useful to hear some feedback to see if you've got any specific queries or specific questions affecting your hall. The acre information sheet, we're on version 7. I think you should all have copies of that. It is very, very comprehensive. It's covered most of these issues that we've been talking about this morning. It's just sometimes good to have a reminder of the key points, the pertinent points when it comes to the hygiene in the hall. So looking to the future, really, I think COVID is going to make a huge difference to the way all businesses, charities, village halls are going to operate in the future. I think they're going to be a lot more conscious of the hygiene and the risk of any sort of cross-contamination, any virus, you know, the normal flu that we get every single winter. We're going to be so much more aware of how that can be transmitted, and I'm sure people are going to be so much more courteous about making sure they've got clean hands when they greet people, and it's probably going to be a lot more hygienic in the halls. So can you hear me okay?
Yep.
Okay, that's fine. I'm not sure if everybody's back, but
Helena?
Yeah.
Helena, could you turn off your Outlook so we don't keep seeing the notifications of your emails when they come in?
Are you getting those coming up?
Yeah.
Okay.
Thanks.
Okay. I'm going to minimise and see if I can get you back again in a minute. Hang on.
Don't worry, Helena, your Outlook's not open. It's just a notification. Oh, it's out open there, is it?
That one.
Yeah, just.
Yeah. Okay. So, it's asking me to sign. Get rid of that one.
Yeah, just go back to Zoom.
It's asking me to sign
No,
in.
You don't need to.
Cross that out. Yeah.
No, yeah, just leave it.
Or get rid of it.
Just go back to your, just bring up your PowerPoint again. It'll be fine. We're still seeing your screen anyway.
Yeah. Okay.
Yeah, just click on the PowerPoint button at the bottom of your screen. There you go.
Yeah, you've got that back. Okay.
Yep.
Spread of coronavirus, we talked about that, but talking about aerosol transmission, up to 3,000 droplets per cough, potentially, if somebody's infected, that's what can be circulating around in the air as aerosol particles. So it is quite scary, something we can't see. We don't know how far it's spreading. We don't know where those particles are going to land on what surfaces. So yeah, cleaning is essential, and the frequency of the cleaning, I think, is the main thing. Especially frequently, government keep telling us, you know, hands, face, space are really the key for minimising the risk of the contamination on different surfaces within the hall. And as long as people stick to those, and you're doing all the right things to instruct them, the right posters are up, you've got your hiring agreement in place, you've got all the right equipment in place, the cleaning materials, that whether your cleaner is coming in between different user groups or whether the user groups themselves are using the cleaning materials and products that you are providing to do the cleaning prior and following their sessions, that is, you know, that's as hygienic as you can be within the hall. You're doing the correct the correct things. Okay, so reducing the spread of the virus, things that we've just mentioned, you know, the hands face space, making sure that you're providing perhaps more bins than you would normally, and making sure that people are disposing of their tissue safely. Bins are emptied regularly, making sure that, you know, your cleaner or the hiring group are making sure that they use detergent, because, you know, going right back to the beginning of this session, the detergent is almost more important than the disinfectant, because if you're not lifting the dust and the dirt and the particles off a surface, then, you know, you can disinfect, and then if there's still dirt on that surface, there is potential for the virus to, you know, use that as a host cell and remain on the surface of that, whatever you're cleaning. So make sure that your hirers know the proper way to clean the surfaces. And again, the basics of keeping the ventilation in the hall regularly. It's difficult in the winter, I know, but it's getting into that habit that they've got to keep the ventilation going through the room, and it's for their safety, it's for the safety of their particular group, and it may mean that the hall has to have bigger heating costs. That's something that you're just going to have to put up with basically during this pandemic. I'm assuming that most of you, or hopefully all of you, did manage to get the Retail, Hospitality and Leisure grant that was available during the summer months. That was the £10,000. The idea of that grant was to cover the costs associated with the COVID pandemic. So increasing heating, extra cleaning, you know, providing more cleaning products, all these are additional costs. And that's what that Retail, Hospitality and Leisure grant was intended to cover. So that should be ring-fenced, really, not being used and spent on other costs for the village hall. You might have to have a more frequent, you know, the cleaner increase their hours to do more cleaning. So the costs of doing that, you're probably not covering those costs in the, you know, from hiring out the hall. So that £10,000 is a buffer to cover those additional costs. And if you were not fortunate to get that grant, then obviously it would be very, very difficult to justify the additional costs. Some halls haven't even reopened at all since March. Others were open from July and have been very, very busy. So each individual hall has to make the judgment what is right for them. I don't know if you've looked at the grants that are around now for the second lockdown. It has been a little bit more difficult to get some financial support, but I would suggest looking on your local authority's website at you know, what they are offering. It was a local restrictions grant, I think. So if you do need information on that, you can either contact me later or do look on your local authority's website for business support. So going back to reducing the spread. Yes, so contamination decreases over time. So the risk of any residual infectious virus is likely to be significantly reduced after 48 hours. So if there's no way that a hall can be cleaned after you've had a user group in there, the safest thing to do is to make sure nobody goes in, no user groups use the hall for a minimum of 48 hours. That's quite an extreme measure, but if you have no way or fear that you know, perhaps your cleaner's ill and there's nobody else able to fulfill that role, if you've had a user group in there, it might be the safest bet to say nobody can go in that hall for a minimum of 48 hours, because, you know, you've got to look at the safety of the people going in there. There is a risk if it's not been cleaned or not been cleaned properly. Right. that's just another illustrative picture of how the aerosols can spread around. I think that's a picture of like a cafe setup. The thing that I think this illustrates, you can't eliminate risk altogether. All you can aim to do is to reduce the risk. As long as you take all these measures, that's all that you can do as trustees. And record all of your decisions, all of your actions, so that if there was any, it's like any health and safety, you have to do risk assessments. You have to record when you've looked at a particular hazard, how you minimise that hazard, and you know what you do, what measures you take to minimise. It's the same for COVID. I would recommend writing down, when you do your risk analysis, write down what you do, how you've instructed your hirers, just to cover yourselves. You've got a paper record if there was any, you know, cases in your hall and there's any queries, you know, if it could have happened when those people were in your hall, picking up the virus in there. Right. Another problem is damp, of course, especially halls that are not used very often. Some halls may be only used once a week, so the trustees may not have the heating on very much and just put it on, just literally for that user group. It is a big problem in underused halls. But they should be well heated throughout the winter months to stop freezing of pipes. So it's a fine balance of how much heat you have in the hall. So this is a way of remembering how to minimise damp. It's called Hive, and it's just adequate heating, adequate insulation, which is a good way of reducing your heating costs anyway, adequate ventilation, which we've been talking about, and avoid excess moisture, especially important during the winter months. Right. Any questions on damp and ventilation?
Nothing's come up at the moment.
No, okay. This is a very good guide. I think it's recommended on the government website as well. So if you want really a comprehensive guide on ventilation and all the technical stuff, go on that link and you can download or read it online, this CIBSE guide, and it has everything to do with what's a safe way of ventilating your workspace, indoor space. So that's a really good guide to be aware of. I think it's available on our website, but I'll check on that one. Right. Again, this is all the other measures to help reduce the spread and to help minimise cross-contamination and to map where the virus may be and where people may have picked up on it. So again, this is all on the ACRE reopening information. So obviously test and trace is a vital thing, and it's a legal requirement to have test and trace, or if not, write down all the people that are entering into the hall and the names and contact details. Basic common sense things like avoid handling money, if at all possible, hand sanitizers, possibly use disposable cutlery and crockery. If you can't, ensure that any catering or drinks, that people are not sharing the cutlery and the crockery. So that has to just be extra care that nobody's touching other people's items. Provide tissues, extra bins, and all things like the signage, social distancing, all the measures that I'm sure you've already put into place. If you need to know the comprehensive information about test and trace, the Appendix M of the ACRE reopening information sheet explains everything about the test and trace. And another very good guide that's been published, it was published in the summertime. It was by IFDU, which are, I think they're architects, and it was produced in partnership with ACRE and Clarion Futures. This is, it's a visual guide, so it's of different layouts and different room layouts and how you can work out social distancing. So if you've not actually seen that, that is available on our coronavirus reopening webpage for village halls. Have a look at it, because it might just give you some tips on how to manage the flow of people. So, you know, obviously social distancing, but how they can arrive at your building safely, leaving public buildings, how you manage people when they go to, you know, register on arrival, how you manage if you've got various rooms and different groups of people in your building at the same time, how you can manage the flow of using the facilities, like the kitchen facilities, you know, toilet facilities, general communal areas, how you would manage the flow of people. And again, we have to remember that a lot of the people that are operating in village halls, they are volunteers. So it's, you know, hard to expect people to manage a village hall like you would do, say, an office space or a proper workspace. But you have to think of it in those same terms, that it is a workspace. Even though it's a charity, you've got to treat it, and the legislation will treat it as though it is a workspace. So if you've not already looked at that, I would recommend that that's a very useful guide, even if it's to reassure you that you've got the right procedures in place already. Right, so obviously kitchens are a big part of health and hygiene in schools. It is a massive topic on its own, so we can't really talk, isn't about you know, how you handle food on a normal basis. It's a whole topic on its own. A lot of the information, if you do need to think about how to operate the kitchen, look at the Food Standard Agency's guidance on good hygiene practices in food preparation. And there's a lot on their website to do with coronavirus. I think the government and scientists have found actually it's very unlikely that COVID-19 is transmitted through food. They're not saying it isn't, but they're saying it's very unlikely. I don't think they found evidence that it is being transmitted through food. It's more likely to be transmitted through, you know, crockery, cutlery, glasses, hard surfaces than it is food. And also the packaging. People that, you know, once the food is being, you know, if you've got food deliveries coming into a kitchen, it's disposing of the packaging carefully. And, you know, if you're disposing of it, wash your hands. Whoever's handling the food, make sure they wash the hands before they then go into the food preparation. So again, all of that information is on the Food Standard Agency's website. Again, it's usually the user groups that are going in, isn't it? That they'll be perhaps making cups of tea and coffee. And it's up to those people that they wash their hands regularly and maintain those good hygiene practices all the time. You know, they shouldn't really lapse and let that slip. If they're touching crockery, if they're collecting cups in that people have used, you know, they take them to the sink, put them in the sink and make sure that they wash their hands. So that next, if they're going out again and touching other surfaces, there's not that risk of that cross-contamination. So kitchen has to be provided with soap and water. so that people have got the facilities to wash their hands. Yes, as we've said, do not share crockery and eating utensils. It may be that you want to use disposable plates, cups, you know, plastic beakers and disposable plates and cutlery. Or you could ask people to bring their own and take their own crockery home with them. So it's not actually being touched by anybody else. And there's no cross-contamination taking place there. And it goes back to the regularity of cleaning surfaces. That is the key in any part of the village hall. It's the regularity of cleaning the surfaces that are going to be touched the most frequently. So, okay. So again, that's the contact there for the Food Standards Agency website. There is another YouTube clip. Actually, I found that last night, and I don't think Emma's had chance. We've not had chance to sort of prepare that. But if you do get a chance, you know, at another time, that is the link. There is a 1.5-minute YouTube clip, and it's just showing you somebody in a kitchen who's cleaning down a stainless steel work surface. You think that's a boring thing, but it just shows you the correct way of doing it. And they put soap and water, they scrub the whole surface down, they rinse it off, sprayed then with a disinfectant, left for the right period of time, and then with paper towel they are drying the surface. Because if you remember straight, you know, right back to the beginning of this session, that bacteria need food, water and air. So the things that you control are moving the dirt or the food debris from that surface and drying it as soon as possible. So if there's no water on the surface, it's eliminating the risk of the bacteria or any dust and particles in the air coming down and reinfecting that surface. So I would recommend having a look at that, or maybe asking your cleaner to have a look at it, or your caretaker to have a look at that. Okay. Right. If you're not sure about anything in the kitchen, about food standards in general, you know, your local environmental health officer is always happy to answer any questions. So, you know, if you can't find the information online, there is the ACRE information sheet on health and hygiene, which has a section on food safety handling. But again, you've got the environmental health officer that you can always ask for their advice. If you have to be a registered food business operator, so if you are providing meals or offering a community cafe, for example, you probably have to get or be registered with the local authority as a food business operator. And then, you know, you would be, environmental health could do periodic tests anyway. But if you're not a registered food business, they can offer advice and information on anything to do with hygiene in a kitchen or in a shop. You may have a community shop attached to your hall. So again, food is involved in the retail of food. Again, environmental health would be only to help, too pleased to help with any inquiries that you may have. If it's to do with the facilities in the hall, in the kitchen itself, again, talk to the environmental health officer and maybe the building regulator or the local authority, so they may be able to help. Say you're designing a new kitchen, they can offer that advice on what would be a good design, what facilities, what you need to have in that kitchen to make it a good environment to keep to the hygiene standards. It's also worth checking when you're looking at, if you're preparing and serving food to people, whether your public liability insurance has a clause on food poisoning. We can't assume it's covered everything. Some village hall policies do automatically have that clause, but it's worth checking that your particular policy has got that food poisoning clause on it or in it. If you're not sure, phone your insurance company up and you can ask them if it's covered. And also, when your hirers agree in the hiring agreement, they are agreeing to follow all food regulations and food safety. Once they've signed that agreement, it's down to them. It's their responsibility. And this same applies if you've got a bar. Lots of village halls may have a bar, a shop, or a stall supplying food. And there are food standard agency posters as well that should be put up in the kitchen, which all the information is on the Food Standard Agency's website. I think any food in a hall, you've got to be careful. You may be having Christmas fair, there may be a Christmas fair or a farmer's market, or people may come in regularly selling cakes or something. Again, the people, you've got to make sure that they know that they are adhering to any regulations to having a stall or selling food on the premises. Okay. We talk about COVID-19 secure premises, and that's in the ACRE reopening information sheet. I'm sure that you'll have all gone through the steps and the stages that ACRE have recommended. So when we talk about hiring out, it's only halls that have gone through that process, and they can be classed as COVID-19 secure premises. So to recap, you've got to do your risk assessment. You've got to set out clearly in your special hiring agreement what your hirers are meant to do, what's expected of them. You've put up all the signage that's required, social distancing, arrows for one-way systems, posters, hands, face, you know, Public Health England posters, which you can get through me if you do need them. There's the COVID-19 secure poster to go up, which is actually the Appendix C of the reopening information sheet. Hand sanitizers when you enter and leave the premises as a minimum. Ensure that you're training your staff, volunteers and the trustees themselves. Make sure that they are aware of all the requirements and the restrictions. Protective equipment for your cleaner, and necessary cleaning equipment and materials. No doubt you're having to buy more of those than you would do normally. First aid box, which is like a special, this is in addition to your normal health and safety first aid box. This is like a preparation with some materials and equipment that you will need if there is a suspected case of the COVID while they're actually in the hall. So that's in Appendix H. There's a list of things that can be put in there. So it's things like plastic gloves, an apron, face coverings, tissues, a bowl, soap, and hand wipes. Basic things, and a bin liner, because all those things, if somebody has been infected, all of the equipment that is used would have to be put inside a plastic bag. So that is a bit like the first aid box. Designated safe area, again, that's an area that if somebody is ill within the hall, that is the place that they would be taken to. Ideally, they would go straight home. You would send them off the premises. But if they can't, or if they've got to wait for a lift, or if they're feeling too unwell, there needs to be an area away from the main crowd of people in the hall. It could be a separate room. You may have room in a store, which is normally a storeroom. Maybe you may have sufficient space in there that you could have a chair waiting. That if you need to have somebody and separate them from the main hall, that would be the designated safe area. And then obviously track and trace for NHS purposes. Right. Okay. Right, so we're talking about the aerosol infection and people with it on their hands. So the risk of the infection spreading is obviously the type of surface that has been contaminated, the individual, the time the individual spent in the setting, which obviously increases the risks, and the time since the individual was last in the setting. So if it was over 48 hours ago, 2 days ago, then it's very unlikely that they have left any active virus behind. So that that's like your risk analysis in a way, what you're looking at when you're cleaning and what needs to be done to mitigate that. Right. Right, so we mentioned before coffee break that we'd talk about how long the virus can remain active on different surfaces. So you can see there's a massive difference from a few hours up to 5 days. So that's really quite a useful guide to know. It's how long the virus remains stable. And this was tested in a controlled lab setting. The New England Journal of Medicine did this, and various studies. So it is quite, I think, accepted that these lengths of time that the virus remains active are, realistic. Obviously, there will be different circumstances, but as a rule of thumb, I think that's what they're saying. So things like aluminium could be tins, for example. It doesn't live very long at all on aluminium tins. Copper, so if anybody is handling coins, it can be active for 4 hours. I think the mindset, what the scientists would recommend is that nobody's going to really consciously take this into account, are they? You're not going to think, well, am I touching metal? How long do you think the active virus can be active on that surface? You don't think in those terms. So the safest thing to do is have the mindset that everything, every surface, anything that you might touch, or everyone and everywhere is contaminated. That's an extreme way of looking at it, but that's what they're saying. Rather than thinking what might be safe, what might not be safe or least safe, think of it in terms of that actually potentially everything and anything or everybody could be contaminated. So you treat every surface, every person, and everywhere that you go as though you've got to take extra care. So everything, yeah.
We've had a comment about the slide earlier that referred to possibly closing a hall for 48 hours to try and minimise the risk of COVID infections. Yet some of the information on this slide is saying that the virus can remain active for up to 5 days. So that it's a bit of a contradiction. What would your comment be to that?
I think it's looking at, this is going by the recommendations in the acre information sheets. Obviously, I'm not a scientist when it comes to this.
Sure.
The information in the acre information sheet is from the government, so I think it might be taking a balanced view, and perhaps the risks are very, very minimal. They might be saying that up to 3, 4, 5 days the virus will be degrading, but there would be evidence of the virus, or a less active evidence of the virus on those surfaces than there would if it was freshly contaminated. I don't know a definitive answer on that. That's just going by what is being recommended.
Sure. And do you know if ACRE has mentioned anything about non-solid surfaces, i.e. fabric surfaces? Because
yeah, well, we'll be mentioning that a little bit in the next slide or two. But I think going back to that earlier question that was raised, this is assuming that nobody's gone in and cleaned, isn't it? So it's like saying you don't need to leave the hall empty for 5 days. If it hasn't been cleaned, I suppose potentially it could be 5 days, but it would be very, unless there's a good reason, why is the hall not being cleaned? I don't know. But yeah, there is a bit of a dichotomy there, isn't there?
Mm.
So, I mean, ideally somebody would be going in, or the user group would be cleaning when they leave the hall, but I'm sure that doesn't always happen. I'll try and find out a little bit more on that, but that's actually a really good question. The picture here is showing actually the different types of surfaces. Obviously there's the glass window. So the glass is up to 5 days. Then you've got wooden window frame, which says 4. And then you've got metal radiator there, which is 5 days. So all of those surfaces, the virus could potentially remain for quite a long time, remain active on those for quite a long time. Again, anybody cleaning these areas, obviously when they remove their, at the finishing of the cleaning session and using rubber gloves, then wash the gloves and try and dry them before they get them stored away. And then the cleaner would then have to clean their own hands properly. So that's vital, the continual hand washing.
And just about other question, just going back slightly to the kitchen catering area of the presentation, but I assume that dishwashers are usually very good at disinfecting things because they wash at such a high temperature. So would you agree with that?
Dishwashers are ideal for any crockery and things. Yes, they are. If you're using your own village hall crockery and they go in the dishwasher, I think the crucial thing is anybody collecting them from tables or from a hatch area. So somebody's picking up those, the crockery, putting it into the dishwasher. It's if there's any virus on the cups, plates, whatever, to make sure that they wash their hands. They can go into the dishwasher. I would then wash my hands before then shutting the door and setting the controls. Otherwise, you're spreading anything that you've picked up from that crockery. You've shut the dishwasher door and then put the controls. You would either wash your hands first, or the other way is to put the dishwasher on and then disinfect and wipe down and clean the front of the dishwasher. So again, it's thinking about cross-contamination, but the crockery themselves in a dishwasher is ideal. I think it's a relative low temperature that the virus can be killed. I haven't got it with me at the moment, but you can look that up. So a dishwasher would definitely make that a safe thing to do. So I hope that answers that question. There's very little evidence about paper, like post, newspaper, any mail that might come. I think the evidence on that is inconclusive. So I know it says here cardboard for 24 hours, but the science here is saying that it's inconclusive on how long it's living on sort of normal paper, I suppose office paper, you know, mail, newspapers. So again, I think anybody handling paper on a daily basis or in the hall, keep washing their hands on a regular basis. As a good rule of thumb, they are saying every 2 hours that if you're in a workplace, working in an office, just, you know, 2 hourly, wash your hands or sanitize on a regular basis. You have to assume that everything is potentially contaminated. Okay. Right, so we did say that what would the cleaning regime have to be if it's just the normal village hall cases of the COVID-19? Basically, it's the same as you always have done, but it's more often and cleaning those areas that are touched the most frequently. So in order to minimise surfaces that can be potentially touched, the village hall committee need to sort of remove from the hall as much clutter, things that are not necessary, things that might be difficult to clean. Just think they're not needed. We can always bring them back when COVID is over. They're not needed, they're not essential. Let's just remove them from this public space. We'll put them into storage, make it easier for the cleaner, that when they come in and clean, they're not having to go through all these stuff that's not needed. So that's the first thing that can be done. And again, you've instructed the cleaner or the caretaker to increase the frequency of cleaning on those areas that are frequently touched. And it's perfectly okay, as we've said earlier, to use standard cleaning products. Detergent, because that will remove the dirt, and then the disinfectant to get rid of any bacteria or viruses. But the detergent is just as important, if not more important, than the disinfectant. Going back to my days in the NHS, we were responsible for cleaning operating theatres. And, you know, it was quite surprising when we sort of mentioned this to people, but the domestics, as they were called then, when they cleaned the operating theatres, we did not use disinfectant. We used detergent, and that was the only thing that was used, because the theory was if you clean thoroughly and all the dirt, the debris, everything is removed from the surfaces, then it is a hygienic environment. So do not be afraid when people say we're just using detergent and water, that is not good enough. Detergent is essential, otherwise you're not going to remove dirt and grime or grease. If there's any grease or dirt left on a surface, the disinfectant will not work anyway. So the cleaning bit is more crucial in a way, and the disinfectant bit is then if there's any remaining bacteria or viruses, it will kill them. But the detergent and the cleaning bit is vitally important. So going back to the operating theatres, the domestics would do the basic cleaning, and then the nursing staff would wipe down the essential, you know, theatre bed and their equipment. They would sterilise their equipment. But the actual role of the cleaner or the domestic, we did not use disinfectant. So that was quite surprising when I told people about that. But it just demonstrates that the detergent and water is really essentially what cleaning is. Disinfectant does not clean. Disinfectant kills bacteria and viruses. Cleaning is detergent, because that is what will remove the dirt from the surface. So that's just the basics of cleaning. So I think that's a good point to get across. So again, if there's been if there's no suspected case, as a minimum, obviously the frequently touched surfaces, as a minimum, wipe down twice a day if you've got a user group going in. anything that's a high risk area, like your kitchens, your washrooms, especially if they've got various groups in there, more than one group, and the number of people that are using the hall, you know, more frequently. You've got your frequently touched surfaces like the kettle handles, the fridge door, toilet handles, taps, etc. So again, it's just thinking about what is happening in your particular hall, the frequency, the number of people. And also you've got to think, are you instructing your user groups to do this, or are you having a cleaner coming in before a group and after a group? Again, that will vary from hall to hall. But if you haven't got a cleaner that's going in, then you're having to, the user group has to agree that they're going to go in and clean down the main surfaces that they're going to use and be in contact with. It's their responsibility to clean before and after that user group's been in the hall. And if there's no suspected cases, then the cleaner can just wear their normal cleaning overall or apron that they use. There's no need for any special protective equipment at this stage. It's just the same basically as a normal cleaning regime, but more frequently. It's more of the same rather than taking extra measures. It's doing more of what you would do normally. Okay. So that's just to show a list of the high touch, you know, areas. So if you've got people working in your building, there may be an office space, so they've got all the you know, computer equipment to think about, computers, keyboards, phones, tablets, all the basic things that need to be cleaned down. Oops. Right, so where someone has the symptoms or confirmed COVID-19, I think if it gets to the stage of being confirmed, they shouldn't be in the hall at all anyway. So it's more really if somebody develops the symptoms while they're attending the hall. I think there are measures in place that they should not be attending, you know, before they get to the hall. So anybody going in should, you know, not be going in at all if they've got a high temperature, lost the sense of taste and smell, or developed a new persistent cough. They're the three, aren't they? The three key symptoms. So if somebody suddenly starts coughing a lot while they're on the premises, or suddenly feels hot, they've got a temperature, then, you know, it could happen while they're actually attending the building. Right, so it's got those three key things there, so people know what to look out for. Okay. Right, so if somebody has symptoms, the event organizer is really in control. Not necessarily, you're not going to have trustees on site potentially. So whoever has hired the hall really has to take the control of what to do at that stage. So they should ask that person to go into the special designated area and keep them separated. If they can go home straight away, send them home straight away. If not, they go to that designated area. So personal protective equipment, for the person that's looking after them, but also for the cleaner. So anybody going in cleaning, the minimum, they'd have to have disposable gloves. So they'd use them the once and then dispose. Oh no, so this, sorry, is for the person that's looking after the person that's put in the designated area. So disposable gloves and an apron that can be washed down with soap and water after removing. Right, but for the cleaner, so the cleaner that's going into an area, again, they've got to have disposable apron, disposable gloves. So at the end of the session, when they're cleaning, they would dispose of the protective equipment, put it into a black bag, and then once that bag is full, if there's other things that need to go in, that's contaminated waste, once that bag is full, then it would be tied and then put inside another black bag and put somewhere separate away from the general waste. And again, all this information is in the ACRE guidance. I'm sure you've read all of this already, but it's just important to know that it has to be treated differently to normal domestic waste. So once anybody's taken off their glove and apron and put it in the bag, they would then make sure that they wash their hands as well. It's unlikely that they would need to have eye visors or anything to protect their mouth and nose over and above just wearing a normal mask. But if it's a high, in some high risk areas, I think if, for example, somebody's spent overnight, so if it's in a hotel or a hostel, then the cleaner would have to have something to protect their eyes because there's more risk of the virus where somebody's been in that place for a very long time. So it's not likely that that's needed in a village hall setting. Appendix L has got the treatment plan for suspected COVID. So anybody that has been sent home should immediately self-isolate for 10 days, and then that's up to them to book a test for with the NHS. And everybody in their household should isolate for 14 days as well. So going back to the cleaner, if they are using disinfectant in an area where there has been a suspected case, they're better if they're not opening sandals, wearing open shoes, such as a sandal or a flip-flop or whatever somebody may wear at work. They're better to have closed shoes. I don't know the exact reason for that, but it's that's what's being advised there. If you need to find more information, then Public Health England and your local health protection team are there to answer any queries as well. So after somebody has been removed, gone home or moved to the designated area, thorough cleaning and disinfecting of all surfaces that the person has come into contact with, and any potentially contaminated and frequently touched areas. So even if they've not definitely touched, then obviously it's a thorough clean of the hall, using the same materials, cleaning and disinfecting as you would for no COVID. It's just being more thorough, making sure that all the areas and surfaces are washed and wiped and disinfected, but use disposable cloths and disposable mop head rather than your normal mop. It's something it can be disposed of, put in that black bag along with the PPE. So disposable cloths or paper towel and disposable mop heads to clean all hard surfaces, floors, chairs, door handles, sanitary fittings. Think one site, one wipe in one direction. If not using disposable materials, then items need disposing of as contaminated waste. So if you were using a material cloth or a J cloth, only use it for that one cleaning session and then it has to be disposed of. Avoid creating splashes and spray when cleaning because there's a potential of spreading the virus by splashing it around the area. Okay. That's just a chart there comparing what you would do for laundry, washrooms and waste. So the column on the left is if there's just the normal situation where there's no symptoms, and then the one on the right is if there has been COVID symptoms in the hall. So laundry, you wash Yeah, so it's a little bit more precaution if there has been symptoms. So you wash clothing as normal, or the cleaners overall. Use the warmest water setting that is recommended on the label. So you're not going to wash an item at 90 degrees if it says you can only wash that item up to 40 degrees. You just wash it at the highest setting that it recommends on that label, and dry the items completely. Do not shake before washing because of spreading it in the air, and any areas that clothing has been in contact with, then make sure that you wipe down and disinfect it. So any laundry basket, anywhere that laundry has been in contact with, make sure that area is cleaned. Washrooms, here we are. So obviously no symptoms, it's as you would be doing for your normal frequent cleaning with detergent and disinfectant. But for the COVID, use disposable cloths and then dispose of with the contaminated waste along with your PPE and any used tissues. So nothing can be reused again. Think of it like that. So waste, normal waste, no need to separate, dispose of as routine waste as normal for no symptoms. If there have been COVID symptoms, all of the personal waste, cleaning products, tissues, anything that you've used, put it into the plastic bag. When it's got all the items in there, tie that securely, put it into a second bag, tie that securely, so it's double bagged. Mark it in some way that it is contaminated waste. And you can't put that with the general waste until it's been stored away separately from your main household waste for 72 hours. After that 72 hours, then that bag can be put with your normal waste to go with the normal bin waste. So it's not too onerous. It's just being aware of what needs to be done in either scenario. Has anybody had a COVID symptom? Has anybody had somebody in their hall where they have gone down with symptoms? I mean, yeah.
Lots of shaking of heads, not many.
No. Yeah, it could happen. And I think basically it's just being prepared in advance that if it does happen, those are just additional steps that you've got to take. So they're not actually that onerous. They're not too difficult. I don't think it's anything to be scared of particularly, even though you wouldn't wish it. I think it's just being systematic. Just go through the processes, tick off, we've done that, we've done this, we know what we should be doing. It's important that a user group, if they have a suspected person, that they inform the cleaner or inform the trustees, so that the trustees can inform the cleaner. There's no point that group dealing with it and then just leaving the premises without letting the village hall know what's happened. It's essential that they know, and that's set out in the special hiring agreement. But it's good to perhaps remind that group on a regular basis, look, if somebody does go down with COVID symptoms, make sure that you follow the regulations and the rules that we've set out, follow those procedures, and also let us know, because there's also the track and trace element of it. That's down to the event organizer to make sure that they've got contact details of everybody in the hall, whether it's written down pen and paper or whether they've used the NHS test and trace method as well. Whichever way they do it, it's down to the hall user to record and then to let people know if there has been a suspected case. So it's down to common sense to make sure that everybody knows what their responsibility is. Right, okay, so we'll go on. Right. Other cleaning methods, yeah, it's 12, isn't it now? Yeah, just I think 1 or 2 to go. The cleaning, we're talking about upholstered furniture, clean it. But go by the manufacturer's cleaning recommendation or the label. I mean, some say loose cushions and things may have to be dry cleaned, but if they are actually, you know, upholstered, then you can steam clean. Carpets can be cleaned, mattresses can be steam cleaned. Curtains, if anybody's been in touch, you know, touch curtains, you may want to take curtains down anyway as a precaution. But if you've still got curtains hanging, they can be laundered or dry cleaned. So fumigation or misting, I don't know a great deal about that, to be honest. One site, it said indoor spaces, routine application of disinfectants to the environmental surfaces by spraying or fogging is not recommended for COVID-19. I think the word, the thing there is where it says routine. I think it's not meaning that you can't use fumigation, fogging or misting, but you wouldn't use it routinely. I think it would have to be an extreme circumstance where you've had quite a few outbreaks and you can't control the virus in the environment. It would be a last resort, or in extreme circumstances that you might want to go to what they call fogging. So it would have to be done by a professional firm. I don't know what the cost would be. So I think this is ultraviolet is another method I know nothing about, but obviously these are in extreme cases only. So that is if nothing else works and you can't sort of eliminate, or there's been lots of cases of coronavirus, it might be a one-off that you might have to do. So there's the HSE link there that you can find out more information about that. Okay, other activities to consider at your hall that you may need to look at different risks. Again, community shop, any retail, food and drink we've covered, farmers markets, Christmas fairs. Vaccination is something that might be involving village halls. I don't know yet. I know in other parts of the country, I have heard that village halls are being used for vaccination stations and being taken over for that purpose by the NHS. At the moment, I've not heard of anything in Derbyshire, but it could well be that Derbyshire will look at some venues and some of those will be village halls. So that's something that we will be watching very, very closely at the moment. And again, we don't know what the cleaning regime requirements would be, whether it may need some sort of fogging after it's been used as a vaccination station. I do not know, because potentially you've got lots and lots of people coming onto those premises. So other clinics and things, gyms, you know, follow the advice for gyms and sports facilities. And again, there's information on the government.uk website for other workplaces, office space, and any other type of workspace. That's just references. If anybody wants to get more information on any of the things that we've talked about, there's lots of places where you can get information. A lot of it, the government.gov.uk website has all sorts of information. Cleaning in non-healthcare settings outside the home, you've probably looked on these websites already. Sometimes it's difficult to disseminate the vital bits that are really important, and that's the role of ACRE. They have done that fantastic job of you know, interpreting the regulations and, you know, how they apply to village and community buildings. But if you want to go down to the main source, it's all on the government website. Okay, so it's just gone 11. If there is time, I'm happy to hang on and answer any questions if people have got some questions. Depending on your time.
We've had a question from Janet Smith asking about Febreze. they're used obviously to spray on fabric surfaces to help remove odours, but do you know if that is also does anything from a COVID point of view?
I really don't know. It's not a product that I've used myself. I've seen it on adverts on the telly. So again, it's a case of reading what it says on the label, I think. It may, I mean, it's being sold as reducing odours. It's not being sold as a product that kills or cleans. So, you know, kills bacteria or germs or viruses. So again, it's going back reading the label, I think. So I can, you know, perhaps look into that, but I don't know the answer to that one at all. It's not a product that I've personally used. If you're not sure, see if there's another product, and that's just to get rid of odours, isn't it? So if there's odours off upholstery, it may be looking at different ways to clean the upholstery.
Well, Louisa suggested Zoflora in a diluted solution to help. That's been used in holiday cottages that have to comply with COVID cleaning.
Right, yeah. And what's that product called? Flora?
Zoflora, Z-O-F-L-O-R-A. I've heard of it.
Okay. Yeah, yeah. I think it is basically going back to reading what the labels are on all of the products. We can't assume that they're going to do the job that we think they may do. Or consulting the manufacturer's websites or contacting the manufacturer just to find out. There's so many different makes and products on the market. I mean, they should now say that they will kill the coronavirus, but I don't know whether they all do. I know the Dettol one does, which is for hard surfaces, obviously. So that's all I can say.
There was a comment earlier, actually, on the chat that that Dettol is being challenged about their claim. Well,
it may be. Yeah. I'm just going by reading the label, Ben. So that's mis-selling. If that is not, if they are a make that are claiming to kill 99.9% of bacteria and viruses, and that's being challenged, then that's mis-selling.
Well, it is just hard to know, isn't it? Because things have to be proven, so it's hard for us to really be in a position to make a definitive comment, I suppose.
Yeah, we can't recommend any product over another product, and I was not recommending Dettol. I was just pointing out the fact that you read the label to get the information. If you're not certain, look at their website or even get in touch with the manufacturer. But you know, RAD can't recommend one product over another. Unfortunately, that's out of my scope. So I know it depends where people buy or where they source their cleaning materials. Some might just go to the supermarkets and buy household products, which should be adequate. Others may go to the cash and carry and buy it in bulk. There may be other sort of wider options from the cash and carry because they're providing products and materials for businesses, which may have higher stringent specifications. Again, what I would just suggest is read the label properly. If you're not sure, contact the manufacturer, look on their website. And if, again, if something's being disputed, it's very hard for you to be, be responsible for that. If you're reading the label and it says it's going to kill 99.9% of viruses and something happens, it's very difficult. You're not going to be held responsible. Not that you're not just doing this to cover your backs, you're doing it to make the safe place for your users and volunteers. So it's a difficult one, but it's just being aware that not all products are the same. That's all. I think that's all I can say on that, really. These slides, we will send you the slides so that you can refer back to them. If anybody has any follow-up queries, I'm very happy to answer emails, respond to emails if there's anything there that you want further clarification on. So it's got the contact details there. We are all working from home and will be doing for quite a long time. We don't know yet when the restrictions are going to be lifted, which, you know, I think, Emma, did you say yesterday that the it's going to be reviewed on the 19th of December? We're in tier 3. So, you know, it's, we don't know whether we're going to go into tier 2. I'm hoping we go into tier 2, but we don't know what's going to happen.
Okay. Can I just say that I will do something with the video so that it's available. I'm not quite sure how I'll make it available. And also I forgot to pause the recording during the coffee break. So we'll have 10 minutes of nothing, I'm afraid, but it's better than pausing it and then forgetting to start it again. So we will send out the slides and we will send out pertinent links as well as part of the email, so you don't have to go through the slides, because I think what I'll do is I will circulate the slides as a PDF, in which case the links may not work anyway. So we'll make sure all the links are in the body of the email. And as Helena said, if you've got any follow-up questions, then point them in Helena's direction. And if she doesn't know the answer, I'm sure she would do her best to find it out for you.
Yeah.
So yeah,
it is. Yeah, a lot of this, because it's so new, everything is new, and it's, you know, it's difficult for anybody to understand, and it's very difficult for village halls, parish councils, whoever they are, volunteers running, you know, village halls. It's so difficult to know. And to ensure that everybody's doing the right thing, all you can do is try your hardest, put the measures in place, and just minimise the risk. You're not going to reduce the risk 100%. All you can do is minimise it. And that's, you know, that's all you can do. It's very hard. So let's hope it will not go on and on and on too much longer. So it'd be interesting to know if we end up being vaccination stations, I think. Not all halls, but some halls might be vaccination stations. Okay, I think, yes, we've gone over the time. So thank you very much for attending. And future training events, we will notify that in the normal